So we're going to go over how to test yourself to see if you have enough hip internal rotation range of motion for the golf swing. And if this may or may not be contributing to any pain that you may be having in the hip and or possibly the low back. So what you want to do is you want to sit in a chair. You're going to sit with your thighs on the chair, feet are flat on the floor, okay? And what you want to do is you're going to take the outside of your ankle bone. I'm going to use my right side first. You're going to try to rotate that up towards the ceiling. So it's going to look something like this, just like so, and then just back in. You may feel a little bit of cramping or some muscles being worked on the side there, but that's okay. But you want to see how far you can go when you're doing this test. Now, we're aiming for about 45 degrees of rotation here. And obviously we want to test both sides because both sides are important in the golf swing. So if you're not getting to 45 degrees, you're not going to be passing the test, and your hip may be causing some issues in your low back or in possibly the hip if you don't have enough range of motion on either side there. So some big things you want to make sure that you're not doing while you're doing this test is while you're doing it, you don't want to lean over towards one side. You don't want to kind of go like this. You also don't want to have this leg kind of come back behind you as you're doing this. So try to keep your thigh kind of parallel to the floor, and then we're just rotating out as far as we can. Again, trying to get that ankle up towards the ceiling and just back down. So again, we're going to do that on both sides. Give that a try to see if you're limited in your hip internal rotation range of motion.